Did you know as a Kansas high school student, you can get your tuition paid for a technical career like nursing? To learn more, we're gonna head down to WSU Tech. So we're here at WSU Tech, here with Katie at the Simulation Center. So why don't you tell me a little bit about the program here?
Well, health sciences has a lot of different programs. We have the Surg Tech program, we have the Practical Nurse program, we have the Registered Nurse program, which is starting in the fall. We have the EMT program, we have Vet Tech program, we have CNA, CMA. We just have a lot of programs that are available here.
So is CNA a part of the Jumpstart program, do you know?
Yes, it is.
So what would that involve, getting your CNA and going to, WSU, for example?
Yeah, so we can go, this is one of the great things about the new program that's coming. We are gonna start a bridge program. So you can go from CNA, get your CNA license, then go to the PN program, Practical Nurse. Then you can do the bridge program that is hopefully gonna be starting not this fall, but the following fall is the plan, and get your registered nurse. Then you can go to WSU, the Shocker pathway, and get your BSN, Bachelor's in Science and Nursing, go all the way to get your master's, and you can actually go to get your DNP, Doctorate in Nurse Practitioner.
Wow, that seems very simple, straight line just from CNA all the way to the doctorate.
Yeah,
that's pretty cool.
It is very cool. There aren't very many programs where you can do that.
What kind of things can RN do that a CNA can't do?
Yes, so an RN has more training than a CNA. So we are developed to assess patients, which is a huge difference in what a scope of practice compared to a CNA can do. We give medications, we do IVs, we can actually assess and collaborate with physicians in the patient's healthcare to help give a better all-around care for our patients.
Awesome. Are there many jobs that are open for CNAs and RNs right now?
There are so many jobs open for CNAs and RNs, and the great thing about both of those is there's so many different areas in the field of medicine that you can go to. There's hospitals, there's clinic settings, there's long-term care facilities, there's specialty care, there's the OR. There's just so many different areas that you can get a job in. So if you kind of get tired or realize it's not your fit, you can always look for another area.
So now we're going to talk about this mannequin we have here. So you said that they use these for CNA and RN. So can you tell me a little bit about that?
So we like to use mannequins to kind of work on our skill sets. So whether it be giving them baths for the CNA, working on turning, comfort, all of that, making the beds. Vital signs, we can actually get vitals on these mannequins. With RN, we put in NG tubes, put Foley's in, trach care, vitals once again. So yes, we use these for skills, and then also in the RN and PN programs, we have simulation, where we can actually put them in kind of a hospital room setting or some type of other setting and run through a scenario where they actually have to take care of the patient, figure out what's going on, use those critical thinking skills.
Well, that's awesome. So it's testing the students a little bit with their skills, seeing how they're going to handle stress maybe?
Yeah, so it's testing not just their skills on hands-on, but also communication skills. And it's a great way that it's obviously a low stakes. You're not going to kill Nurse Ann here. She's going to stay alive and come back to life if you accidentally did do something to harm her. So that way they get better practice when they go out into the clinical setting.
That's awesome. So what all things can you do with this model that can help simulate these things? Yeah,
so she actually breathes. She blinks. You can change her breath sounds. So if she has pneumonia or something on that sort, the nurses will listen and actually hear that there's, diminished spaces, maybe some crackles up here. You can listen to her heart sounds. You can listen to her bowel sounds. You can put an IV in. You can get a blood pressure on her. You can feel her pulses. She does quite a bit.
So then what kind of things does a phlebotomy or a EKG, you said, right? What kind of things do they do?
So phlebotomists are the person who comes into the room and draws blood on a patient for labs. And then EKG is the person who will put those lovely tabs on the patients and actually be able to read what their heart is doing.
So if you could tell a student who's interested in this program, but maybe on the fence, what would you say to them?
If you have a caring, compassionate heart, then this is the program for you. If you can deal with blood and guts as well, then this is the program for you.
I want to thank Katie for having us out today. We've learned so much today, and thank you for having us out.
Yeah, thank you very much for coming out. We've really enjoyed having you.
If you like this video, make sure to comment down below, as well as subscribe. We do stuff like this all the time. This is Bailey from FutureMaker Lab. See you next time.